Now that we have a clearer understanding of the basics behind blood pressure and hypertension as a whole, let's dive into why it is referred to as a silent killer, and why it's important to not let it go uncontrolled. As we have discussed earlier in this series, hypertension is the number one risk factor for the number one cause of death worldwide, cardiovascular death. Additionally, hypertension is the leading risk factor for the development of stroke, atherosclerotic buildup and heart attack, heart failure, peripheral vascular disease, decrease in vision, and chronic kidney disease. These different problems are collectively referred to as end organ damage. Let's talk about them very briefly. Data has shown that there is a convincing link between hypertension and kidney disease, and nearly 85% of people diagnosed with chronic kidney disease also had hypertension. In fact, uncontrolled hypertension is the number 2 cause of renal failure among Americans behind diabetes. The exact cause and progression are multifactorial and quite complex, but the evidence is clear that inadequate control of high blood pressure can lead to progressive loss of native kidney function. Want to know what the single most important risk factor for all types of stroke is? You probably can guess by now. It is hypertension. High blood pressures can lead to the vessels within the brain being more easily blocked or bursting. Data has been studied for years, and the results continue to indicate that uncontrolled hypertension greatly increases not only the incidence of stroke, but also the likelihood of mortality from said stroke. Patients with a history of hypertension can be at increased risk for acute coronary syndromes, like heart attacks, and there is some data to support the notion that higher blood pressures are associated with a worse prognosis after these cardiac events. When comparing men and women without hypertension to those with hypertension, evidence has indicated that when adjusting for age and other risk factors, the risk of developing heart failure was 2 times more likely in men, and 3 times more likely in women who had hypertension. Even more discouraging, the 5-year survival rate for hypertensive patients who develop heart failure is somewhere between only 24 and 31%. Hypertensive retinopathy is the medical term that refers to microvascular damage within the retina that develops due to higher blood pressure being present within those vessels. This in and of itself can lead to visual disturbances, but hypertension also can contribute to other serious damage within the eye, including retinal artery and retinal vein occlusions, which can cause complete and permanent vision loss. It's indicated that hypertension is the second most important risk factor behind smoking causing disease of the vasculature. It has been determined that atherosclerotic plaque buildup can be in part due to high blood pressures. These buildups can lead to narrowing or even complete blockage of the important vessels carrying blood to your legs and arms. Peripheral vascular disease is the second most commonly cited reason for loss of limbs in the United States. I say all of these things not to scare you, but rather to educate you. As you can see from this brief overview, the consequences of not taking your blood pressure control seriously can be detrimental to some of your vital organs and therefore to your quality of life. If you have any questions regarding further specifics, reach out to your provider. I am sure that they would happily answer any questions you may have.
Created using Powtoon.